Yep, I'm ready to go. I'm Berks County Commissioner Christian Leinbach, and I want to welcome everyone to our Berks County Commissioners Weekly Update. Our program today is focusing on the COVID-19 spike and vaccines specifically. We have a number of guests. None of our guests are new to this program, and they each are critical members of the Berks County COVID-19 Health Advisory Panel. We have Dr. Deborah Held with us today. We have Dr. Deborah Held. Boy, there's a real good one. I'm just looking at one name and reading ahead to the next one. So we have Dr. Deborah Powell, Dr. Jeffrey Held, and Dr. Mary Kelleher. I'll be introducing them formally in just a couple of minutes. But I want to begin by giving my colleagues an opportunity. And actually, before I do that, I'm going to ask Mary Buer to read the comments directive for our viewers. Mary?
Thank you. Comments or questions must be germane to the topic being discussed. Please include your full name and municipality where you reside. If you are from the media, please put your name and who you are with. Non-media participants, please limit your questions and comments to one per person.
Thank you very much. And we are, as always, broadcasting on Microsoft Teams live event. We're on BCTV and also on Facebook and YouTube Live. And at this time, I'd like to recognize the Vice Chair of our Board of Commissioners, Commissioner Kevin Barnhart. Kevin?
Thank you, Commissioner Leinbach. Thank you to our esteemed panel of doctors. Really appreciate your time. I know your time is very valuable, and I hope we are going to learn a lot today from the questions that are going to be put to you. Vaccines, that's the word of the week. You know, the kids on the radio Monday morning from Muhlenberg, the word of the week, that is vaccine. So looking forward to the information you're going to be giving to us as well as our community. And hopefully everybody is patient through the next few weeks and few months till we get the vaccines out to as many people as humanly possible. So thank you, and looking forward to the discussion today.
Thank you very much. And Commissioner Michael Rivera.
Yes, thank you, Commissioner Leinbach. I also want to thank Dr. Powell, Dr. Held, Dr. Kelleher for being on this show today and providing such important information. I know your time is valuable. You've been on here many other times as well, so I really appreciate you taking up your time to share this information with the residents of Berks County and answering any questions that they may have. We've been getting calls and questions and emails about the vaccines, so hopefully a lot of those questions we'll be able to answer today. Just want to make everyone understand that you may not get the answer that you're looking for today, but you will get an answer as to what the process is, where to go, and what's coming up next. So please stay tuned with us, and if you can, invite other people to join us. So we want to get this information out to as many people as we possibly can, because we do understand that there are a lot of questions out there in reference to the vaccine, the process, and how I go about getting one. Again, to the doctors on here, thank you very much, and I'm looking forward to the information that you're going to share today.
Thank you very much, Commissioner Rivera and Commissioner Barnhart. As was stated, vaccine is the big issue, has been for the last several weeks. It's been driving a lot of the communications that county commissioners, county departments have been receiving. I know that's also true of our healthcare partners. People want to know, when can I get it? Where can I get it? And I want to ask Stephanie Weaver to post up a link, not just of our doyourpartberks.com website, but if you could specifically post the link to the vaccine page. There's some valuable and helpful information, including a GIS map of Berks County that allows you to look at locations that are able to give vaccinations. You have to check with them to make sure they have vaccine availability. but that list is compiled from the Pennsylvania Department of Health for the entire Commonwealth. And you can zoom in and look at the locations for Berks County. Before I go to the panel, I also want to note that our involvement as a county with the County Commissioners Association, there is a task force that's been meeting virtually on a regular basis with the governor's office and with top staff of DOH. We've been doing that since May of last year, but the last 3 weeks, our discussions have revolved around concerns with the distribution of vaccine by the Commonwealth of Pennsylvania and with serious concerns around the messaging. We've shared with DOH, you can't just go out and say everybody 65 and older needs to get the vaccine and not let them know that there are real challenges relative to supply of vaccine, et cetera. In the last week and a half, those discussions have become very strong on the part of county commissioners, and this is not a political thing, and it is not regional. I can tell you, commissioners, myself from Berks, commissioners from Chester, Butler, Tioga, it's rural, it's urban, it's a major issue. So it's appropriate that today we have a great panel to discuss the issue of vaccines. And at this time, I'd like to introduce our panelists. First of all, as I mentioned, Dr. Deborah Powell. She is the Section Chief for Infectious Disease and Medical Director for Infection Prevention at Tower Health Reading Hospital. Dr. Powell's been a frequent spokesperson for Tower on issues related to COVID-19 in both the media and during town halls and other events. We also have Dr. Jeffrey Held. He's Vice President of Medical Affairs for Penn State Health St. Joseph's Medical Center. Dr. Held is Penn State Health St. Joseph's Clinical Liaison with the County Commissioners and the Berks County community during the COVID-19 pandemic. And then Dr. Mary Kelleher, Chief Medical Officer of the Berks Community Health Center. As I noted before, all three of these individuals have been on prior shows, and they are a critical part of our Berks County COVID-19 Health Advisory Panel. Welcome to the program.
Thanks for having us.
So let's jump right in, and as I normally do, I'm going to switch up the order, but I'll start with the first question going to Dr. Powell, and it is the approval of vaccines for COVID-19 is certainly some of the most encouraging news we've had regarding the pandemic. We'd like you to give us an overview of what your medical facility is currently offering for vaccine distribution and an estimate of how many people you've been able to vaccinate to date.
Happy to do that. And just to put into context too, we're seeing an incredible surge with COVID cases. So again, we've had 100 million cases worldwide, over 400,000 deaths in the US. So it's a considerable problem. So thank your listeners for joining in today. So what we're doing at Tower Health is we're following the phased approach that the Pennsylvania Department of Health has asked us to follow. So again, the 1A phase is where we're in right now, and we're vaccinating those that are in long-term care facilities, healthcare providers, and those over the age of 65 with medical, and those between 60 and 65 with medical conditions. As of this morning, we administered almost 12,000 doses to date at Reading Hospital.
Thank you. Dr. Held.
We are following a very similar. We are following a very similar process, focusing on the 1As, reaching out to our community providers, getting the physicians and their staff, as well as leveraging our primary care groups to identify those patients that need the vaccine and are on our specialty clinics. We've given about over 3,000 vaccines, and that's consistent with our supply. We've we are getting continual supply to ensure that we have enough doses to give the second dose for each set. We've received both Moderna and the Pfizer vaccine.
Thank you very much. And Dr. Keller.
Hi, we received the Moderna vaccine. We started initially with vaccinating our own staff and then partnered with healthcare workers in the community to become another point of vaccination for them. With the expanded category of 1A to include patients and those 16 and older with coexisting medical problems, we have now started to open up to patients, both patients that are established patients at BCHC and have created and are working to create access for patients in the community who are not BCHC patients. To date, we have given around 1,000 vaccines. And we're trying to work very hard to partner with people in the community to increase our capacity to even offer more vaccines.
Thank you very much. We're going to go right now to a question from a viewer, and I will tell you this is probably the most common complaint that we're hearing as commissioners, and I know others are hearing across the Commonwealth of Pennsylvania. And this comes from Sarah Kate Fry out of Ambler, Pennsylvania. It's impossible to get appointments anywhere, ! And the process is very unfriendly to seniors who need vaccines. Start with Dr. Held. What's your response to Sarah's concern?
It's a legitimate concern, and I definitely have heard similar concerns throughout the county and people I've been in talk to. If you look at how we're doing this in the community and in the nation, this is an incredible logistical effort to distribute vaccine to an entire nation and to leverage a healthcare system that is designed for acute care to identify key people and get them in to the appropriate center to get the right vaccine. So we are all kind of marching in the same direction. We're getting more efficient and effective at identifying and scheduling and vaccinating patients. I'm very confident that everybody who needs and wants a vaccine will get that vaccine. It's just going to take us time to ramp up and get the supply we need in order to ensure that we can vaccinate everybody.
Appreciate that. And a change, I just got a clarification. The original question said Ambler. It's actually Sinking Spring, Pennsylvania. Dr. Keller.
Yeah, as soon as the announcement was made to expand the group outside of healthcare responders, it was within an hour that I think we had 600 messages on our answering machine. And the inquiries have not stopped since then. We hear you. We're trying to make personal responses back to people, letting them know the process, trying to streamline the process. But what I want to do is validate what you're saying, and that it's incredibly frustrating. It's incredibly frustrating for us as healthcare providers too, because we want nothing more to vaccinate our community and to have them to have access to the vaccine. So we're dependent on vaccine supply. We as a health center are also dependent on staff in order to administer the vaccine. We're looking to even hire people specifically for the role of running a vaccine clinic, something that we weren't planning on doing, but hearing the community demand, we're trying. But we really do understand, but we also need to ask people to be patient because we're trying to do the best we can, as the healthcare systems are too. But currently, right now, the demand is so much greater than the vaccine supply and the resources that's where the imbalance is leading to a lot of people's frustrations.
Yeah, without a doubt. And Dr. Powell, before we go to you, another question popped in, very similar, but it's specific to Tower Health. This is, and I'm actually not going to read the person's name because they didn't say where they're from, but I know the person. They said, I called my Tower Health doctor and they don't know about anybody getting the vaccine at Tower Health. What gives?
Okay, we are vaccinating people over the age of 75 currently. So again, we have a large pool of people that want the vaccine, which is really good news. The bad news is we don't have enough supply right now to vaccinate all those patients. So we are tiering this out in a staggered approach. and we get more vaccines, we open up more appointments. Typically at Reading, we are vaccinating about 600 people a day, but we have not vaccinated in the last 2 days because honestly, we have no supply. So once we get the next shipment, we'll open up more appointments for people to schedule.
And I mean, this is a common refrain that we hear, that nobody's giving out vaccine. And I'm straying a little bit from our prepared questions because this is what's being asked. Mm-hmm. That's not true. But if you're one of the people that haven't been able to get an appointment or haven't been able to get through to your provider, it definitely feels that way. How do we deal with better messaging so people understand the number one issue here is supply? And supply for Pennsylvania comes in 3 different ways. And hang with me for a minute, because right now the healthcare providers are probably saying 3. I thought it was 2. The County of Philadelphia is the exception to all other counties. They get vaccine direct. The long-term care and nursing facilities are getting vaccine direct. And when I say direct, from the federal government. Everybody else is reliant on the vaccine coming to them through the Pennsylvania Department of Health. And that includes the county's departments of health, or the handful of cities in Pennsylvania that have departments of health. And you don't have control over that, right? And I'm looking for answers from all 3 of you. You don't control the supply. That's a big part of the problem, is it not?
Yeah. That's correct. We put an order in, we request for a vaccine, and we wait to see how much we get.
Yeah, just this week we were trying to plan for a vaccine clinic, and it's hard to plan and then disappoint people when the vaccine doesn't arrive. So we got notification, we had lists of patients who were eligible for the vaccine. We got notification that we were going to get 200 doses less than the vaccine we requested. And as quickly as we got it, we're trying to put it in people's arms. So we have, once we got the notification that it's coming, then we quickly work to get people scheduled. But we have to put a little delay in opening up schedules, because then there are places around the state and country that are canceling vaccine clinics because they built all these appointments and then the vaccine didn't arrive. So we have a very short time between receiving our vaccine and opening up appointments for people in the community, and we're trying to do that as quickly as we can.
And again, our goal is to get these vaccines into arms. We don't want to hold them. We want to get them out as soon as we can. And we don't open appointments until we have the vaccine in hand.
Yeah, and I think that's consistent for all of us. And I think that message is ideal here. Our goal is to get the vaccines out of the fridge into patients as soon as possible, but we don't want to schedule and then cancel people, because that's probably a worse experience, getting your hopes up that you'll get the vaccine and say that we don't have enough. As soon as we know we have a supply, we open up that next schedule with the next set to make sure, and then we get it out there.
And this is an unusual situation too, because we don't really want people lining up to get the vaccine. We're in a pandemic, so we want to have scheduled appointments and people arriving, and not having lines and lines of people waiting for vaccines out on the street. And you see some of those images from Florida, and that is not our goal.
Yeah, absolutely. And just for the record, we did get the information. That was from Ernest Turbine Schlegel out of Reading, Pennsylvania. We have more questions there, but let me go back and reference the questions that we have here. How, in your facility, when you're vaccinating folks, how is the best way for someone in the 1A category that you described already to schedule an appointment for a vaccine?
Who do you want to take it?
And we're going to start with Mary Keller.
Okay.
Right now, again, just kind of following up on what we just stated, that we're not having those appointment availability until we have vaccine in hand. So I think the key thing is to let us know that you're interested in the vaccine. We created a query on our website So you can go to the website, and both as a healthcare worker, because we have not yet completed some interested healthcare workers and people out in the community, or as a patient, you submit an inquiry. We have staff going through those inquiries, recording them. At first, we were trying to call people back, but the numbers got so overwhelming that those personal callbacks were not able to happen. We complete that list, and as we have a vaccine clinic available, then we go through that list of eligible patients and then offer them a time to sign up for the vaccine. So in our office, it's just going to our website and submitting an inquiry of interest for the vaccine.
Yeah, and just so folks know, on Microsoft Teams, and I believe our IS staff have posted this up to Facebook and YouTube, we have the link to the Do Your Part Berks vaccination page, and about halfway down that page, there's a link to each of the vaccination pages for the representatives that are on today. So we have one for Berks Community Health Center, one for Tower Health Reading Hospital, and one for Penn State St. Joe's. I encourage you to go there to get additional information. Dr. Held, what do they do in a Tower Health facility or Reading Hospital? How do they schedule?
You're switching the places on them, Chris.
Yeah. First, Dr. Powell and I are married. Now you're switching our hospital.
Oh, whatever. I don't know what I'm doing here. Yes, go ahead.
Yeah. I'll take it for Penn State Health St. Joseph.
Yes.
So, you know, when we opened up our phone system, we soon became overwhelmed with calls, like I think everybody has. So we've done a similar process where we've identified patients within our physician groups and leveraged that group to reach out and schedule each of the patients so that we can get them in, and identifying the most at need and most at risk. Until we have a process where we have a much larger supply of vaccine, where we can open up, you know, mass vaccination sites, we're really focusing on a targeted approach so that we don't overwhelm the system with phone calls and prevent us from actually being able to get people who need healthcare visits and have acute issues, and ensuring that we can get the right people in as quick as possible.
Thank you very much. Dr. Powell.
Yes, so again, we're targeting those over 75 years of age because they're at the highest risk. And our first step was communicate with those patients, and we have a couple ways to do that. So we have an app called My Tower Health or My Chart, or by phone or by mail. And those in that category that did receive a communication that their vaccine has been ordered. And as the vaccine arrives, they can schedule their appointments. Again, they have to keep checking back to see if that vaccine is available to them, but this population does have that available. So, and again, the state has a website, they have a vaccine tracker, the local news organizations do. We also have our information up online, as I'm sure our colleagues do also. So those are great resources for your listeners.
I'm going to go through some of these questions. They're very similar from people online. Again, this person doesn't have where they're from, but I'm going to read it. My elderly parents, 73 and 77, don't have internet. I had to fill out an interest form. My father's PCP with Penn State Health can't even get him a vaccine at St. Joe's Penn State Health. He told him he needs to get it as soon as possible, as soon as it's available, but basically he's on his own. Sheesh. I think it shows the frustration. There's another person, Shirley Miller out of Reading, Pennsylvania. My Tower Health family doctor doesn't have the vaccine. Why did Reading Pediatric have vaccine for a pop-up clinic? And she goes on to say, why doesn't Berks have a health department? Other counties use this for the ease of scheduling. I know each of you are aware because the health advisory panel has been sharing information. This is not unique to a county without a Department of Health. This is happening right now in Philadelphia. There is a, I don't even want to go into it, but a nightmarish story about what they did in setting up a mass vaccine clinic. And the last 2 days, Philadelphia has pretty much cut ties with that entity, and it wasn't their Philadelphia Department of Health. There are issues going on right now in the Lehigh Valley where there's basically competition between two hospitals, And when you talk to the folks involved at the county level and the health departments, and there you have Bethlehem City Department of Health and the Allentown City Department of Health, they're acting completely outside the Department of Health. We've raised this specific issue with the Pennsylvania Department of Health, saying we don't understand where these are coming from, and they seem to be happening out of the blue. We've received calls on the Reading Pediatric Pop-Up Clinic. We'll start with Dr. Powell. Can you answer the challenges of the availability, why these things pop up? No one seems, or very few people seem to know about them until they're there, and people's frustration on getting on a list. My executive assistant texted me and she said most of the people she talks to says, just let me get on a list. So I'll throw that out. And I know this is tough. These are not easy answers. These are tough questions, but share what your experience and what your opinion is.
Yeah, I think these are really tough questions. And again, we're opening up appointments as we get supply. And our patients over 75 have been invited to, schedule their appointments. So they have an order pending. Once we get supply, they're able to register. And I totally understand. And there's other small pharmacies and large chain pharmacies and grocery stores that have pharmacies, they're able to get supply. So other entities like the Reading Pediatrics registered as a site and they got a shipment, and that's how they rolled their supply out. So I think that there's ways that we can help to coordinate with each other, but it's really a challenge. And it's even elevated because now we have to administer 2 doses a certain number of weeks apart. And so you have to get people back, and we have to set up those additional appointments. As we get additional vaccines that only have 1 dose, that'll be easier. And also these vaccines are very, they're not forgiving. So you have to have, minus 80 plus centigrade freezers to put them in. And then they're only, able to be used for a certain period of time after they're defrosted. So you really have to, as Dr. Held was saying, it's a logistical issue. It really takes a lot of coordination.
Dr. Held.
Yeah, and to add to that, it not only the logistical issue, but remember the vaccine does expire. It's not as if it'll sit in the refrigerator indefinitely. There is a certain point at which you must give the vaccine out. For the Pfizer vaccine, once we take it out of the refrigerator, it's got 6 hours of life in it until we get it into arms. So we really have to do just-in-time processing of that vaccine and making sure that we have all the patients lined up and in the building in a timely fashion. This is really tough, and it is what happens when we have a limited supply and a huge demand. I think everyone on this call and probably everybody listening wants to get the vaccine out to as many people as possible, as soon as possible. We will endeavor and continue to try to do that. These experiences are unfortunate. The communication that has gone out and the changes that we have all endured from this process, from the state, from the federal government, the messaging changes so quickly sometimes that we're not even able to tell our own physicians, here's the plan now. So, some of the messaging that the physicians are getting is because they haven't had a chance to catch up on their email in order to see what we are doing next as the process changes. So I am very sorry for the experience that everybody has had with this. We can only ask for patience as we get there. We're going to do our best to ensure that that all of us on this call are going to make sure that we do our best to vaccinate everybody in Berks County who needs and wants a vaccine as soon as we possibly can.
Thank you. Dr. Keller.
Again, just to reiterate what Dr. Held and Dr. Powell have said is, we understand that when people are looking at it from afar and they've called 10 places to get a vaccine and have been told there's no vaccine available, to then read in the paper that 400 people had access to a vaccine is what leads to the frustration. Why them? What, who did they know? What connection were they? And I don't think that malintent is there. I think people are really trying to offer vaccine as quickly as possible as soon as they get it. So there sometimes is nothing available and then suddenly something becomes available. So the people who have the vaccine are then left with, how do we get this out as quickly So sometimes there's a pop-up clinic or there's suddenly a sign-up list that's activated. So I think the intent is to really vaccinate people, but the quick turnaround is getting people to think, I saw some analogy of waiting to get concert tickets, like you're, up and waiting to see where you can pop in. And that's very stressful for people who are trying to protect their family and loved ones. So we at Berks are trying to be consistent, trying to make sure we follow the indications and the rules, getting the waiting list set up so when there's availability, people are reached out to. But I think that's what's leading some of the people to be upset because they're wondering, why is that person getting it and not me?
Absolutely. Another comment here, Sherry Lovelace, Regal, Sinking Spring. Do not see any place to register on Tower Health or Penn State Health sites. Consistently, this is one of the complaints we get. Where do I register? Just to sign up so my name's on a list. Pennsylvania, almost 3 weeks ago, Dr. Levine told counties, and actually I think it was a statewide press conference, announced that within a week or two, the Commonwealth would have a link up that all the counties could distribute where people could sign up and get on a list. Within the last couple of days, we were notified that's not going to happen. That's the kind of frustration that really confuses folks in knowing what to do. But in this case, is there a reason that there isn't a link, or is somehow Sherry not finding the link on the Penn State, St. Joe's, and Tower Health Reading Hospital site? I'll start with Dr. Hill.
Yeah, we have not put a link to specifically register for the vaccine because of the sheer volume of patients and trying to determine what status that individual would fall in. And rather than having you enter in your entire health history, we're going to leverage the data that we have based on your your physician's knowledge of you. And that'll make it easier so that we can do the right thing and get the right people in and not inadvertently jump tiers in the vaccination process.
Dr. Powell.
Yeah, I would encourage our patients to get a MyChart account. And again, they can go through a kind of a question tiering structure, and it tells them if they're able to get the vaccine at this time and if there's any vaccine available. I think that's the easiest way. I do understand that those over 75 may not be computer savvy. They may not have all these, bells and whistles to schedule that vaccine, but that's the easiest way currently to be scheduled, because those orders for those over 75 in our patient base have that order placed, and we're just waiting for the supply to come.
I think the other thing I want to emphasize, and we had this conversation with our CCAP task force and DOH in the governor's office last Friday, at the current rate of vaccine distribution, we will not get to a 70% vaccination rate until mid to late summer, and maybe not then. There has to be a fundamental and dramatic increase in the availability of vaccine. And there's two issues right now. One is the overall availability, but two, and I'm going to ask the doctors that want to jump in on this to do so, there was an anticipation that by the end of January, beginning of February, that at the very least, Johnson & Johnson and AstraZeneca would have had their EUA into the FDA and would at least be in the process. And right now, it seems up in the air on when they're going to come into play. We're still relying on only 2 approved vaccines, one of which really can only be distributed by major healthcare facilities because of the temperatures required, and that's the Pfizer, I believe, is 80 below zero. Can you talk a little bit about understanding how long it's going to take to vaccinate folks based on the current vaccination rate and the challenge around only having 2 approved vaccines? And I'll start with Dr. Powell on that.
Yeah, so we're still waiting for the Johnson & Johnson and AstraZeneca vaccine to come through the FDA for EUA approval. So until that happens, we can't really progress with those vaccines. And it's not clear to me when that's going to happen. I've been hearing mid-February, but that might be optimistic. They have to finish their phase 3 trials and get some data and then show the effectiveness and see if it's equal to the vaccines we already have available. So more to come. There's other vaccines coming through the pipeline, and we'll have to wait to see how effective they are too. How long this is going to take, I'm with you. Maybe next, until the midsummer, until we actually get to the 70% that we need between those who have natural immunity and those who have received the vaccine.
And I haven't had any conversations with anyone from the national government, or the federal government. So this is more kind of the press and reading as everyone else has. But it does look like this administration is willing to take up the Defense Production Act and start to mandate the production of vaccines in much higher numbers. And that may mean some of the vaccines that are not yet approved, not yet shown the efficacy, getting put on hold a little, where concentration on production can be to the vaccines that have been proven to be effective. And so in the media, that is being flown out, and when it's going to happen, or if it's going to happen, I don't know, but that does have the potential for a mass production of vaccines to then be able to be distributed to the states. And we're hoping that's what happens. So some of those vaccines that are not yet approved may not yet get approved, but the ones that are approved can be produced in massive numbers to then get to people's arms in the states. So we're dependent on the federal government making that process work, and hopefully it does.
Thank you.
I would say as well, just to realize something you've never done before always takes you longer. And the more you do something, the better and more efficient you get. And I think that's the best way to look at this entire distribution system. The vaccine companies are making the vaccine as fast as they can. And the federal government is trying to do all they can to help them up. The distribution system is getting better and better as time, because of the transition in administration. I'm sure that it's caused a bit of a delay just because of the nature of handoffs that happen. But I'm sure the current pace at which we're giving vaccines will speed up over time as the vaccine supply increases.
I'm going to go to more of the questions that are coming in, and there are a lot. Ashton Middleton from Wernersville. Hi, docs. Are there any people or conditions that are contraindicated for the inoculation? Start with Dr. Powell.
Yeah, so this is, we have, again, limited background, but as far as we're aware, the only people who cannot get this vaccine are someone who had a prior reaction to this vaccine or any of the components of the vaccine. The primary reactions that we're seeing are the polyethylene glycol component, but really almost everyone can receive it, including pregnant women, patients with cancer. So I would encourage most patients can get it.
Is it fair to say that if they have any question about some underlying issue, that they talk to their healthcare provider or family doctor?
Absolutely. So there may be some nuance regarding their history that I'm not aware of. So I definitely talk to your primary care provider.
Right. And if you don't have a primary care physician, Berks Community Health Center is a great resource. And I'm putting in a commercial for them, but they serve the community and they serve the underserved. And I'm not taking away from the great work that St. Joe's and Reading Hospital do, but Berks Community Health Center, that's what they're all about. So we don't want to forget, if there's a question, check with somebody who is a healthcare provider, either specifically for you or someone like Berks Community Health Center. Anyone else want to jump in on that question regarding contraindicated, folks that might be contraindicated for inoculation?
I guess the only thing that I would add is that we don't want people who are actively infected with COVID or who are in the middle of their isolation or quarantine. So this would not be the time to come. And if you were on a list to get the vaccine and you have active COVID symptoms, we would not want you getting the vaccine at that time.
Absolutely. Very good point.
And the CDC is stating that you can wait up to 90 days and have significant enough native immunity that the likelihood of reinfection is extremely low, and suggesting that if you have been, take advantage of those 90 days to let someone else get vaccinated. And in our health system, in Penn State Health, we've given about 55,000 vaccines, and we have had minimal to no reactions. And most of the reactions that we've had have been consistent with every other vaccine that I could sure everybody on this call has provided to a patient in their careers.
Great, thank you. Very good information. This is really a comment and offer. Michael Toledo, the Centro Hispano, Reading, PA. We stand ready to partner to serve as a community vaccination center when we have vaccine supplies. We all have a role to play. Stay safe. Marcia Goodman Hinnershitz, Reading, Pennsylvania, and one of our great city council women in Reading. Even when the supply is more adequate, the process for registering for vaccines is challenging, especially for seniors with no access to technology. How do we help to connect individuals who are not part of existing health systems to vaccines? And I think I'm going to take this right to Dr. Kelleher first, and then to your colleagues.
Yeah, you know, it's a great question because we had texted our patients. And at first, you know, we were waiting for the responses and they were a little slow coming in, and we texted our 75 and older. And then someone said, you know, no grandmas are texting. They hate texting. They want you to call. They want you to talk to them. They don't want to text. And so there's definitely a point in that. You know, we think that everybody has their phones on them at all points, that they're texting automatically, that they have computers. And a lot of our patients, especially at Berks Community Health Center, don't have that IT technology. So we started to revert back to phone calls. But the problem with that personal connection is as the numbers grow, making those personal phone calls becomes harder and harder. But we're trying to reach especially our elderly by calling out to them and calling their homes. We do ask families to support their elderly parents, and if they don't have the technology, maybe assist them with signing up, because it is true that some of the older patients don't have, might not even have a cell phone or a computer in their home in order to sign up for those sites.
Thank you. Dr. Held or Dr. Powell?
I would say just be patient with us during this process. I think, you know, because of the supply, we really need to kind of do a focused targeting approach. And as we get more supply, we can start to create a more effective and efficient scheduling process that will allow us to get more and more people.
And I agree with all that's been mentioned. Again, seniors with technology access is going to be a problem. So we may have to go by phone, as Dr. Kelleher mentioned, but it's a very slow way to get information out there to patients. So it's really not our preferred way to go, but that will be our backup method, and possibly even sending out mailers to people. Again, also an even slower process than telephone calls.
Absolutely. We have a comment here. Why doesn't Berks County have a health department? Folks don't seem to realize this, but there are 61 out of the 67 counties that don't have a health department. Now, one of those, Delaware County, is partnering with Chester County and has a MOU with their health department. But we'll be talking more about that in the future. We're not going to get into that right now. Another note here from Lois Antozzi, Spring Township. Tried to schedule through Tower Health, but there's no way to schedule. Another note here, Shirley Miller from West Reading. I completed a form for West Reading Pharmacy. Their answering service says they have no vaccine, don't call them. Again, I would suggest keep going on to the link. It's at near the top of the page of Do Your Part, Berks.com. On the vaccination page, it links to the active GIS map, and it not only shows facilities that are able to give the vaccine. According to the Department of Health of Pennsylvania, any of the dots that are green indicates that they believe that facility currently has vaccine. Chuck Brantman, Muhlenberg Township. This may be a question for many months from now, but I've heard that these vaccines are not approved for children under the age of 16. Will we not be vaccinating children as a rule, or will there be a different vaccine for children perhaps later this year? I'm going to go to Dr. Held on this. If you want to start us off.
Sure. They are doing research on the vaccinations for pediatric patients using the existing vaccines. The details of those, more information to come, but we'll have more specific information as that research and those trials progress.
So what is the age break that people can, I shouldn't say currently, but right now the vaccine is for what age on up?
It's approved for 16 to 18 with the Pfizer product. They did a small study with children. Moderna was not indicated for kids. So we need to do more studies with children to see how effective they are.
Yeah, and we're talking a lot about vaccine demand, but there's, vaccine reluctance. And one of the things about vaccine reluctance is, was it rushed? Was it approved? Was it studied? And so the younger children is an age group where those studies, less than 16 don't yet exist. So as Dr. Held said, they're working on that study, but the last thing we want to do is promote a vaccine safe in children and effective in children and not have the data to support it. So when we're talking to people of vaccines, we all believe that the vaccine has been studied and been safe. And until those studies exist, that indication is not out there, making it all the more important to vaccinate those around the younger, more vulnerable patients who might not have access to the vaccine.
Question, and this is, I've heard this before too. Where do you go on my chart? This person commented earlier, she went on and she can't find it anywhere. Is that under the messaging?
Yeah, they'll get a message through my chart when they're able to schedule. So it may depend on how old that person is and if they're actually in the category that we're vaccinating right now. So right now we're doing 75 and over. Even though younger people are, eligible to receive it, we have to prioritize who we're going to go with. So I know they sent out like 11,000 messages to people in that category saying that they're eligible to get the vaccine. We just don't have that many vaccines to give out to patients at this moment.
Richard Almus, Reading, PA, are the sites that are up on vaccination signups in Spanish or just in English?
I can answer that for Berks Community Health Center. Our website has a place where you can translate all the material from English to Spanish, and the sign up then does appear in Spanish. And we do have bilingual staff, a large bilingual staff that could then call patients back or address it. And we'll have bilingual staff at the vaccination clinic events when we have them. So we're very sensitive to the fact that people need information in both English and Spanish.
Yeah. And I'm going to have to remind some folks here, primarily there's one, I'm not going to say her name. We have an opportunity for one comment per person, not multiple ones. This is a comment, they didn't give a name, but I'm going to give the question because this is what the commissioners from CCAP have been saying to the Department of Health. Tired about hearing about logistics. These people had months to plan. Is the problem poor planning or a lack of supply? Number one is a lack of supply, but there also are some challenges around that. I don't know if you want to, any of you want to jump in and talk about whether it's just a lack of supply, poor planning, etc.
I think it's primarily lack of supply. I agree with you. I know at Tower we're able to do about 600 people a day, but if we don't have the supply to administer those vaccines, we're kind of, we're in a stalemate just waiting for that supply to come. But I think additional planning would have, from the federal level, would have been very helpful.
Dr. Held or Dr. Keller?
I would echo Dr. Powell's statement. It's true for all.
Yeah. Yeah, and I think, most of us who are type A and like planning and like organizing and getting schedules set up, this has been frustrating for us because, you can't do all of that if you don't know that you're going to receive the vaccine. So I would love nothing more than to say, you know, a week from now, this is the vaccine clinic we're going to do. This is how many appointments we're going to have available. This is the staff put in place. But we're finding we can't do that because we're not for sure the vaccine supply we'll have on those future dates.
Another question before I go back to ours. I think this will get us through or caught up on the live questions. This is from Kevin Hafer in Amity Township. Again, I will tell you the CCAP commissioners have asked this question as well. The state, according to the data this person has, the state only has used 50% of the vaccine allocated to it so far. Currently, Pennsylvania is ranked 41 of 50 states. Each guest states they don't have vaccine. Where is the unused vaccine in the state? Dr. Powell, you want to try to tackle that first?
Yeah, I don't know where the hidden unused vaccine is, but I know within our health system, we have 7 hospitals. And we actually have a vaccine dashboard, and we can move vaccine from one facility to another, but it does require you notifying the state health department that you're doing this. So we're trying to allocate it based on which hospital can deliver it as fast as possible. And then we wait for the next supply.
Dr. Held or Dr. Keller?
From Penn State Health, it's not us keeping the vaccine. It is really, for us, it's the supply. I can't speak to where other vaccines or other systems may not be delivering it as quick, but I think everybody is trying to get it out as quick as possible.
Yeah, as part of being a vaccine provider, you have to have registration with the state on how many vaccines you have in your inventory and how many you have distributed. Part of the limitations we have in accepting as many vaccines is the ability to distribute them. So we try to get to the zero at the end of each week of the vaccines that we have allotted for that week. So there are none in hidden refrigerators, there's none in storage. One week we carried over 10 and we gave those 10 on a Monday. So, you know, we definitely make sure that we try to get the vaccine and give it out as quickly as possible, because all this discussion would make no sense if we had tons of vaccines waiting in the refrigerator. Now, there are vaccines allotted for second doses. So as an example, we were distributed 400 vaccines for next week's second doses. So that may be making some of the distribution look worse than it is because we haven't yet given those vaccines because they're already allocated for people's second doses next week. So I don't know if that's playing some role in the numbers that are being shared.
And Dr. Keller, that is a very important point. Both of these vaccines, Pfizer and Moderna, require 2 doses. I don't know if one or both of the Johnson & Johnson, I think it's Johnson & Johnson's a 1 dose. That makes a huge difference from a scheduling standpoint. It's not just scheduling a person for one vaccine, it's scheduling for that vaccine and then for the second shot. I'm sure that is a challenge, as you said. Dr. Powell and Dr. Held, are you finding that to be a significant challenge for your healthcare facilities?
It is a challenge. And again, we're trying to schedule that second dose at the time that the person gets their first dose. And we're also looking at vaccinating people who are within the hospital. And as they improve before they leave the hospital, if they're in that category, they should receive the vaccine that they get it when they are discharged. And then trying to coordinate that second dose post-discharge is a challenge.
Next question. Understanding supply is an overriding issue. Is your facility working on plans to expand distribution efforts? If so, are you able to share anything regarding what that may look like at this time? And I want to add, the County of Berks, and I know you're all aware of this because of the Health Advisory Panel, in the early fall, worked with the Commonwealth of Pennsylvania, both DOH and PEMA, in identifying 2 facilities in the county, one for indoor mass vaccination, one for potentially outdoor, even drive-through. Those locations were identified, they were approved, and then the county was told we're not going to need those. Now those may be back in the mix at some point, but supply is the huge issue, and that's a significant issue again for you. So what are you looking at each of your facilities when the supply is greater to expand distribution efforts? And we'll start with Dr. Keller.
We've been having a lot of conversations with community partners about how to use their resources to expand access to vaccine. So just recently, we've been talking with Berks Emergency Management Systems about what if we did a large event, could they supply paramedics or who could give the vaccine in addition to our workforce? If we're able to order more, where could we give it at a bigger site? So we're working to try to partner to try to have those increased sites available, because we know that there's a lot of people in the community who are willing and wanting to work with us to get the people in the community vaccinated. So we're trying, but nothing yet is in place.
Right, and we're aware of that. You've been working with Brian Gottschall in Department of Emergency Services, and we appreciate that. Good planning, but supply is a big issue. Dr. Hill.
Yeah, we are looking at outside locations to do a larger vaccination site and ramping up staffing to be able to do this. So we are poised to do this, and we're kind of setting a timeline for us to get all the resources we need into these places so that we can do it throughout the 5 counties that Penn State Health covers.
Absolutely. Dr. Powell.
Yes, we are working on expanding our vaccine distribution. We'll be opening up the Muhlenberg Occupational Medicine site over in Tuckerton Road probably next week. We're waiting for supplies for that site, and we'll probably be transferring some vaccine to that area shortly. So, and we're also looking at adding vaccine sites at 2 of our regional urgent care centers. So we'll have sites that are off-site from the hospitals just for ease of patient access, where you'll have easier parking, easier entrance and exit.
Very good. Thank you very much. We're talking a lot about vaccines right now, but I think many folks are aware that for Berks County, January has been the worst month for COVID deaths since the beginning of the pandemic, and January isn't over yet. So the question is, in addition to distributing the vaccine, each of your facilities, and when I say facilities, not so much Berks Community Health Center, although there's treatment involved, but your facilities are still very busy caring for COVID-19 patients. What are you seeing right now in that regard at your facility, and how does that affect not only your vaccine distribution, but other types of patient care? And we'll start with Dr. Powell.
Yeah, so we've been challenged. We've seen record number of COVID inpatients, twice what we saw back in the spring, and our hospital's been on surge capacity, which means we've opened up extra hospital units, extra hospital wings, extra staffing, resources to outfit those extra patient beds. And the good news is that over the last week or two, we're seeing decreasing numbers. So we're less than 100% occupancy right now, which is actually outstanding because we've been, say, 100, 110% like every day for the last about 8 weeks. And we've had really remarkable number of inpatients, but patients are doing better and our numbers are decreasing. So that's the good news. But again, you're asking hospital systems to take care of all these positive COVID patients, plus our other patients, plus administer the vaccine. So it's been a challenge. Dr.
Held.
Yeah, the good part is we've noticed the decline in our numbers currently, but anywhere between 30 and 40% of our census is COVID patients. And Dr. Powell's point about us taking care of COVID patients, which takes more resources and different staffing models to taking care of non-COVID patients in separate units. And then on top of that, providing the vaccines and remaining and keeping our testing sites open. These are all things that we're doing on top of what we normally did in times prior to. So, talking about logistics, talking about patients, patients as in being patients. I think this is key. I think everybody's really done heavy lifting to do good work here. I think we understand everybody's frustrations with the rollout of this process, but we are all engaged in ensuring that we get over this pandemic and getting back to normal operations.
Absolutely. Dr. Keller, I know you're not in the exact same type of situation, but are you seeing a similar type of impact dealing with COVID-related issues and vaccination on top of that?
Yeah, what we're seeing too, and what we're fearful is because of the pandemic, people are not accessing their regular primary care as much. So we're seeing people delaying mammograms, delaying colonoscopies, not going for their blood work. The chronic diseases that people have not gone away. So people are still having strokes, still having heart attacks, still having uncontrolled diabetes. And the longer those needs get unmet and unaddressed, the more likely you're going to have complications that could have been prevented. So we're incredibly grateful to the hospital systems for the care that they're giving our patients, because our primary care patients are ending up in the hospital and they're still meeting that demand of the heart attacks and the strokes and the traumas and everything else that is coming their way. So we're trying to keep people out of the hospital as much as possible, not just for COVID, but for diabetes, for heart disease, and everything else that hasn't gone away with the COVID pandemic having such a large attention of the healthcare systems and primary care sites in the county.
Thank you. Just a couple questions left. Are individuals who have received the vaccine now considered safe? And let's assume they received both the first and the second shot, and you might want to explain how long does it take after that second shot for the vaccine to be considered fully effective? But the question is, once they're at that point, are they considered safe, or do they still need to follow the recommended safety precautions in place to help mitigate the spread of the virus? And I assume they're talking about masking, distancing, and sanitization. Dr. Powell.
Yeah, so even if you receive the second dose, about 2 weeks after, you're considered fully protected. But it's 95% effective, which is really a remarkable rate for any vaccine, but still 1 out of 20 people may not be protected. And this virus is really endemic right now. So it's really widely spread, and people can carry a small amount of virus in their upper airway without even knowing that they are doing so. And then they could spread it to people who are vulnerable. So we still want everyone to continue to wear their masks, socially distance, and wash their hands.
Thank you. Dr. Hill. May have lost Dr. Hill. Dr. Keller.
Oh, yeah, just Dr. Hill looks like he's coming on.
Okay, Dr. Hill, go ahead.
Sorry, excuse me. Not fast enough on the mute button.
That's okay.
I want to emphasize and re-emphasize what Dr. Powell said. We want to maintain all of the things that everybody's been doing so well in this county for the past 10 to 11 months with masking, social distancing, avoiding large gatherings, and hand hygiene. These are key, and until we get enough people vaccinated that we can be safe, even if you've been vaccinated, maintain those standards.
Absolutely. Dr. Keller.
Yeah, just to be the third affirmation of what they're saying is, social distancing, wearing a mask and washing your hands, and, limiting social gathering as much as possible. Everybody is longing for the days of the big family get-togethers and the parties and the traveling. I'm a mother of 3 young adults and adolescents, and I get it. But still trying to limit your interactions outside of your household is still important, because we're finding that even people who follow all the rules, it just takes one of their children or siblings who are coming over for dinner to take, their older parent out or to do something that is causing them to be exposed. And so the risk is good. The bigger your group is, the more people you interact with, the more likely you're putting yourself at risk. So limiting some of those interactions is still very, very important.
Absolutely. I'm going to incorporate the last question into your closing comments. There's no question, and I think we saw it bubble over in the comments that came over the Q&A today. There is a significant amount of frustration among the general public that want to get the vaccine. Let's not even worry about the people who, for whatever reason, don't want the vaccine. We know that there's a large number of people that do want the vaccine for a variety of reasons, have difficulty getting on a list, difficulty accessing the list, and they're frustrated. What would you say in closing to the public in general? What can you do, or what can they do right now while they're waiting for an opportunity to get the vaccine? What kind of advice do you have as healthcare professionals for these folks? And we'll start here with Dr. Keller, then Dr. Held, and then Dr. Powell.
Yeah, I think instead of talking as a healthcare professional, I'll talk as a as a mother and as a wife, and say, my husband is a teacher with a school that's going in person, and he says to me, when am I getting my vaccine? So here he's looking at me as a CMO of a health center and saying, when am I getting it? And I said, sorry, you're not on the list. You don't have pre-existing conditions. You can't get it. And he's like, but I'm around all these kids, and I get it, but I wasn't able to jump him off the list, and that puts him at risk. And that's my husband, who I love most days. I couldn't vaccinate him. And so, in our personal lives, we too are seeing people that we care about not be able to get vaccinated. And I think that personal response is what motivates me professionally, to try to make sure we're being fair, to try to make sure we're being equitable. We're already seeing maps in the country of places where disproportionately people who are dying, who disproportionately don't have access to the vaccine. And we're trying to make sure that everybody who has an opportunity to get the vaccine gets vaccines, but that people don't kind of jump the line. And we're committed to trying to do that. And I think the two health systems are committed to doing that. But it doesn't mean that we don't understand the frustrations and how scary it can be to think that someone you love can end up infected with what is, we all say, a horrible virus.
Thank you very much. Dr. Held.
And I will say, I, like Dr. Kelleher, I have a wife and family at home who I love all the time. At least I'll say that on the air.
Did you just take a shot at Dr. Heller?
She's very brave. I would not survive such a thing. I think it's very important. My wife and children are at home more often now than they have been, not able to go out with their friends. My son is at the age where he really wants to get a job in the community, and we're new to the community. And I sense their frustration every day about, the restrictions that we have in order to protect everybody in the community. Patience is key here. We've been doing a great job with this process for months. We can get through this together as the supply increases. So I think patience is key. We'll get through this because we've done so well so far, but maintaining that vigilance that we have is extremely important. I think we all hope that the next time, maybe in the winter when we do another one of these calls, we can all be in the same room without a mask. But until then, we'll do it through Zoom or Teams, remotely, and wearing face masks in public.
Thank you, Dr. Held. Dr. Powell.
Yes, and I echo what they're saying too. I have an 87-year mother-in-law who asks me all the time when she can get her vaccine, and I'm trying to get her into the right algorithm to get it also. So the good news is that people want the vaccine. So I'm going to keep urging you to keep looking for it and realize that our numbers of COVID positive inpatients are declining. Our mortality rate per case is going down. We've learned a lot all over the last 10 months. So there's a lot of good news with this pandemic, but it's not over yet. So we still have to continue to do what we've been telling you all along about washing your hands, wearing a mask, and socially distancing. And we're going to have to do that for at least the next 6 months or longer. Even after you receive the vaccine, you're not done yet. So we have to keep going and encourage your family and friends to get the vaccine when they're able to.
I'm going to give a moment to my colleagues if either of them would like to make a comment, but one closing comment I would like to offer. I cannot say enough about encouraging people to research the information that you receive about COVID-19, about vaccines, and please go to reliable resources. Check with your healthcare professional, check with Berks Community Health Center and the hospitals that are represented on our call today. Don't get caught up with rumors. Check it out. That's all I'm asking. I've been amazed throughout the COVID-19 pandemic about some of the claims that I hear and receive, and it doesn't take a lot of effort to check the things out and get the information that's out there. Our healthcare providers here in Berks County are delivering vaccinations and are acting in as responsible way as they possibly can, but it's not easy, and supply is the driving issue. If we had unlimited supply right now, there's a very good chance we wouldn't even be having this program. People would be in line somewhere getting their shot, but we don't have unlimited supply, and we don't have nearly enough to do what needs to be done. That is a key factor. Do either of my colleagues have a comment?
Yeah, I do, Commissioner Leinbach. I just want to thank the panelists for being on here. I know there are a lot of questions and comments on there, related to the availability of vaccines and the difficulty of getting in line or on list or being able to sign up for the vaccine. So I appreciate you being on the call and answering the calls, the questions, as honestly as you could. Just want to remind everyone, we do have to be patient, like Dr. Held said. Everyone is working on it. There are limitations from all sides, so the hospitals are not getting the amount of vaccines that they would like. They can't determine how much they're going to get, so they have that limitation. There's many other limitations. The county would also like to be doing more than we are doing right now, but we also have our limitations. We do not get vaccines directly. We are working with our local health institutions, offering our support, offering to be able to get information out, to do what we can to be able to educate and keep the community informed. So all I ask is please, be patient out there. While we're waiting, maintain your social distancing, keep using your mask, keep doing what needs to get done to avoid the spread. So again, thank you to the doctors that were on here for sharing your information. If there's anything that you would like to get out to the community doctors, please let us know. We're doing that through our Do Your Part website, through our social media, and through all the communications that we can to be able to share the information with as many people as possible. And thank you very much.
Thank you, Commissioner Rivera. I just got a note, Commissioner Barnhart had to drop off, but I know that he is also very pleased with the partnership we have with our health advisory panel, but especially Dr. Powell, Dr. Held, Dr. Keller. You've been a critical part of getting the message out from the perspective of healthcare professionals. We appreciate it very much. Commissioner Rivera alluded to us helping expedite efforts. And just share very quickly, a week ago, we had a major call, I believe a week ago Monday. And one of the things that came out of that call from both Tower Health and Penn State was a need to interface with the Department of Health and the governor's office on approval of applications for additional vaccination locations. And Tower Health reached out to us with their application for the Muhlenberg-Tuckerton site. I contacted the governor's office, and literally within a handful of minutes, the governor's office got back to us and said, we're flagging these immediately. And within a couple of days, those were approved. We've had the same commitment to Penn State, and we are doing what we can. That's what a partnership is all about. And I just really appreciate each of you giving your time. We've been on for an hour and 14 minutes, and I'm sure there are other very pressing things that you needed to do, but you dedicated your time to share this with the public, and I want to thank each of you for joining us. And I want to thank everyone that has joined us on BCTV, Microsoft Teams Live, Facebook, and YouTube Live. We appreciate you joining. If you like what you heard here and you feel this is valuable, you can go back to our Facebook page and our YouTube page and share this program with friends and family in the community. I'm Commissioner Christian Leinbach, thanking you for joining us, and look forward to having you join us in the future for another Berks County Commissioners Weekly Update.